This segment of DelmarvaLife is brought to you by Peninsula Home Care.
Well, most of us have been injured, had surgery, or sought care for some type of wound. And if everything goes according to plan, you heal just fine and you're good as new.
And sometimes life happens and things do not go according to plan. So today we're going to talk about sepsis, and we're going to do that with some help from Peninsula Home Care's Clinical Manager of Care Coordination. This is Christopher McLean, and pharmacist and owner of IV Solutions Infusions. This is Jerry Awancio. Thank you, gentlemen, for
Thanks for being here.
Okay, who do I ask first? I've heard the term sepsis a lot. Explain to me exactly what sepsis is.
So sepsis is a term that we use in healthcare that identifies that there's an issue with an infection. So pneumonia is an infection. So what happens when you do get an infection, your body releases certain chemicals that actually fights the infection.
Yeah.
When you become septic or you have sepsis, your body in turn quits fighting the infection and actually starts attacking its own tissues and organs.
Okay.
Oh, wow. Okay, so are there risk factors or certain people at risk for it?
There's a lot of certain risk factors. The most popular people are those who are over the age of 65, those who are immunocompromised, and those who don't manage their chronic diseases such as diabetes, obesity, and chronic kidney diseases.
Okay. Is there anything that might let you, as the patient, I guess, know that, oh, I might have sepsis?
Certain signs and symptoms of sepsis would be like a low blood pressure, high heart rate, altered mental status. A fever typically comes with sepsis as well.
So in addition to, taking care of your chronic diseases, are there other preventative measures when it comes to sepsis?
There is other preventative measures. Hand washing, definitely number one. Really just managing what you do touch, what you do after you touch something. So just hand washing is the biggest thing that we like to promote.
Okay. Here's where we jump into this. Jerry, this is what I was wanting to talk to you about someone having trouble at home, someone with sepsis, and all the stuff that you haul into their house, and you brought something to show us that replaces all that.
Yes. So in the old days, we used to take everything into the patient's home, IV poles, pumps, tubing, needles, syringes, nurses, everything. Over the years, it's dwindled down to this device right here. This is an elastomeric ball. It's pressurized. We put the IV antibiotic in this ball. The patient will have a line placed into their arm. It's called a PICC line. It stands for a peripherally inserted central catheter. Okay. So basically, instead of getting the IV in your hand like you're used to seeing in the hospital, an interventional radiologist will put one in your upper bicep.
With that?
With this. So once this is hooked up, it's got a little butterfly wings on the end. Once we take off the butterfly wings and attach it to the patient, it just starts dripping the medication in. And what people like Dr. Snyder and the other infectious disease physicians at the hospital are saying, Drs. Kawan and Shimakawa, are sometimes you can be treated with oral antibiotics, and that's great. It's easier to be treated with oral. But if you have a limb-threatening injury, you need something a little bit more powerful or turbocharged. I tend to think before you go to the oral. But this will get you over that hump, and then you don't have to stay in the hospital for 4 or 6 weeks at a time like you used to get a simple infusion every day.
How about that?
Are people surprised to know that they can do something that simple at home?
Shocked. And it's funny, we tease people a lot. When I go see them initially, I say, look, you are not a guinea pig. We have been doing this since 1988. I started back in the old medicine shop, which was beside the Royal Exchange Pub, which you got, I don't know if you remember that. We had an IV lab in back of that. So we have been doing this since '88.
All right, so Chris, community partnerships in something like this are incredibly important, aren't they?
Community partnerships is crucial for something like this. We tend to go to Jerry of IV Solutions, Tidal Health, us, IV Solutions. We want to make sure the community as well. So we tend to partner with those people, and they, from hospital to home, we are going to be there with you from start to finish, and sometimes even after your IV infusion's even over with.
That's
amazing.
That?
Wow. Christopher and Jerry, thank you so much for coming in and showing us that. Amazing.